Crystal, let's try the audio again.
Okay.
Yeah.
Hello. Yeah.
Oh, I hate this
You
thing.
can hear me?
Can you hear me?
Yes.
Is it loud and clear?
Yes. True. I can hear you clearly and loud. Quite clear.
I can see us in Facebook now. I think it's very distractive. I don't want to say what's. TV, I think you messaged me the question.
Okay. Okay, so we will be waiting for 4:30 to start.
Yes. Are you gonna like only show the screen so that you won't see the speaker and us?
Okay.
Already did it live. Oh, you cannot see. Wait. Can. But they are live. Oh, look.
To all cancer patients and cancer survivors, you are the bravest person in battling cancer. Do not lose hope, and we are always here for you.
正在打仗的朋友们，加油！战友们，加油
You have our support. 加油 fighting!
让不可能的变成可能，一切坚持由你开始。
Never give up. You can do this. Yes.
Do let the pain define you. Let it refine you.
Kekuatan tidak datang daripada kemampuan fizikal, tetapi ianya datang dari semangat yang tidak pernah mengalah.
Believe you can and you are halfway there.
Never give up. Never give in.
To our cancer patient, be strong and stay positive. You can do it.
You are not alone and you have a team of members to help you through.
You can, I can. 加油
To stay strong and never give up. 加油！
癌症并不可怕，最重要就是你们要积极的生活，要有正确的心态。
To all my survivors，我们一起加油！
加油加油！
To all cancer patients and cancer survivors, you are the bravest person in battling cancer. Do not lose hope, and we are always here for you.
正在打仗的朋友们，加油！战友们，加油
You have our support. 加油 fighting!
让不可能的变成可能，一切坚持由你开始。
Never give up. You can do this. Yes.
Do let the pain define you. Let it refine you.
Kekuatan tidak datang daripada kemampuan fizikal, tetapi ianya datang dari semangat yang tidak pernah mengalah.
Believe you can and you are halfway there.
Never give up. Never give in.
To our cancer patient, be strong and stay positive. You can do it.
You are not alone and you have a team of members to help you through.
You can, I can. 加油
To stay strong and never give up. 加油！
癌症并不可怕，最重要就是你们要积极的生活，要有正确的心态。
To all my survivors，我们一起加油！
加油加油！
To all cancer patients and cancer survivors, you are the bravest person in battling cancer. Do not lose hope, and we are always here for you.
正在打仗的朋友们，加油！战友们，加油
You have our support. 加油 fighting!
让不可能的变成可能，一切坚持由你开始。
Never give up. You can do this. Yes.
Do let the pain define you. Let it refine you.
Kekuatan tidak datang daripada kemampuan fizikal, tetapi ianya datang dari semangat yang tidak pernah mengalah.
Believe you can and you are halfway there.
Never give up. Never give in.
To our cancer patient, be strong and stay positive. You can do it.
You are not alone and you have a team of members to help you through.
You can, I can. 加油
To stay strong and never give up. 加油！
癌症并不可怕，最重要就是你们要积极的生活，要有正确的心态。
To all my survivors，我们一起加油！
加油加油！
Good afternoon, Crystal.
Good afternoon, Joanne. How are you?
Hey, how are you? Can you hear me clearly?
I'm good.
Hi, everyone on the line. How is everyone doing? Good afternoon.
Hi, everyone. Hope you have a good evening.
Hi, hi. Okay, we see some quite a number of users they are now dialing in. So you get them sometimes, maybe about 2-3 minutes before we start.
Yeah, sure.
Please share with your friend on our Facebook Live today so that we can get more people to view and have more information about nutrition and cancer management. Okay. Hello, Ivy, Simon, YT. Nice seeing you guys. Okay, we are seeing more people coming in. Okay. All right, I think Crystal, we can start already. Give me a second.
Yes.
Okay. All right, so a very pleasant afternoon, everyone over here, and thanks for joining us in this Facebook session. So this month, which is Breast Cancer Awareness Month, all of us know, and we are actually very honored to work together with NCSM, which is National Cancer Society Malaysia, where we will host every week one topic on nutrition-related topics or psychological-related topics. We even have like cancer survivors sharing a journey with us on a weekly basis. So today is our official first week, and then on the same next week, Friday, we're going to have another session again, and the week after another session. So please stay tuned. And today we are going to talk about nutrition myth as well as cancer. And we have Crystal here with us. She is actually the in-house dietitian for NCSM. So of course, she's graduated with a master's degree in clinical nutrition, has very strong interest in oncology nutrition, and also the study of the impact of diet on cancer management, treatment, as well as recovery. So Crystal is here today where she's going to share with us some of the very common myths that we always hear from the people around us and say that, we cannot eat this if you have cancer, or if you are recovering from cancer, or you have just done surgery, you should avoid food A, B, C, and D. But the doctors are telling you that no, you should actually eat this in moderation. So there are things that we, sometimes do not know which one to believe. And then when we Google online, there's so many informations which we also find it quite confusing. So today we have Crystal over here to help us to explain and debunk some of the myths that we always hear. And hopefully we will be able to get more understanding about what is the right diet for the cancer patients. If you have any questions, please do not hesitate to put it into our comment. And then once Crystal has finished her session, we will take the opportunity to also have a Q&A session to answer some of your queries and concerns related to diet. Okay? So I think without further ado, we'll get Crystal to start now her sharing. Crystal?
Okay. So yeah, good afternoon, everyone. First of all, I would like to thank Joanne and CanCare for inviting us to work together to increase the breast cancer awareness among the public. So yeah, just like what you were saying just now, people living with cancer are very concerned about their overall health being, and they are very desperate, want to know more about nutrition. However, the information they get is not always correct. Today, we are going to learn 10 common nutrition myths related to cancer. So yeah, I would like to share my slide. Okay. So I'm the dietitian from National Cancer Society Malaysia. We are seeing patients, and normally we will hear from what patients say. Normally, the patients will get information from Google. They Google themselves what food to eat, what food not to eat, right? They do their own research, or they will ask the friends or their family members surrounding them, and they will get they will get different versions of information. Some of them they know how to search for journals and articles, but the information they get normally come from animal studies. Most of the facts is not come from human study, but from animal studies. Today, we are going to discuss this furthermore. It's actually very important for us to get the right information, especially during cancer treatment or other other treatments going on. So it's very important to get the right information. If we are not getting the right information, or we have this negative perception of food, we will we will experience, or it will result in different type of consequences. First, like we will get not sufficient nutrients, we are underweight, or we will lose weight during cancer treatments, or because we are so confused. We are so confused of what food we should eat, we will get very stressed. And this will eventually affect our overall quality of life. So the first nutrition myth we are going to discuss is sugar. I think everyone's confused about this. Once I get cancer, I cannot eat sugar at all. I need to avoid sugar because sugar can make the cancer cells grow faster. According to study, actually our body needs sugar to grow, but eating sugar does not cause the cells to grow faster. It's growth evenly. So just as what we know, natural sugar actually comes from grains, noodles, rice, bread, and tubers. Other than rice, noodles, or bread, right? We also get sugar from fruits and also milk and dairy products. So we need to get rid of these negative perceptions that sugar can cause cancer to grow faster, because we are still, our body still needs sugar to function normally or to grow well. Second, we are going to talk about is soy, like tofu, fucho, or white tofu, Japanese tofu are all soy products. People also saying that once we get cancer, we cannot eat soy because soy contains estrogen. Estrogen is the hormones that can promote the cancer cell growth. But according to study, the estrogen that found from plant function differently in human body. When we consume soy, or when we consume these soy products, it actually do not cause the cancer cell to grow. And we are advisable to eat soy in moderation. What is mean by moderation? 1 to 2 servings a day is the moderate amount. For example, if you take Japanese tofu, 1 serving is half piece. If you take tau kwa, the firm or the hard texture tofu, right, is 1 piece. If you take tempeh, it's 1 piece of tempeh. If you take fujo, it's like two sheets of fujo. And the third nutrition myth we are going to discuss is dairy products. What I listen from the patient is when we get cancer, right, we should not take dairy, including yogurt, cheese, or any milk powder or milk products. But it is also not advisable. We need to take dairy. Dairy is actually quite important for us because it contains calcium, it contains vitamin D and potassium that can help us to maintain a good bone and muscle health, especially for those breast cancer who are taking tamoxifen. When we are taking tamoxifen, right, it will affect our bone health. So we need to take dairy to get sufficient calcium. What is the recommended amount, or what is the recommended serving size for dairy products? If you take 1 glass, if you take milk, the milk in liquid form, right, is 1 glass of milk. If you take the milk powder, is 4 tablespoons, 1 servings. If you take cheese, is 2 slices. How about yogurt? If you take yogurt, is 1 cup of the standard cup that normally we find it in supermarkets. One day, we are advisable to take 1 to 2 servings of dairy products a day. Then other than dairy, other than soy, right? I also found out that when the patients are diagnosed with cancer, they are very keen to eat berries because they believe that berries can help them to fight cancer cell growth. And when we look at the study, when we look at the scientific papers, the evidence is very limited. There are only studies conducted in animal, but we actually need more human study to confirm how much we need to eat in order to get the effect in fighting the cancer cell, in fighting cancer. So I would advise everyone to eat a variety of fruits. You can eat orange, you can eat apples, you can eat blueberries. Other than blueberries, right, we still have other types of fruits like orange or papaya or honeydew, watermelons. I will advise everyone to eat a variety of fruits. When we talk about vitamin C, right? When we talk about vitamin C content, one piece of orange actually contains higher vitamin C if compared to blueberries. Yeah. From here, we can see that vitamin C can actually obtain from different types of fruits. Other than blueberries, we can actually obtain from orange, or we can obtain from grapefruits and other fruits as well. When we talk about broccoli, broccoli is another type of food that cancer patients normally eat, and they're taught that it can help to fight cancer. Again, when we look at the scientific paper, the evidence is still very limited. We still need more human study to confirm its effectiveness in fighting cancer. Again, I will advise everyone to eat a variety of vegetables. As what we can see here, the fiber content of half cup of broccoli is actually equal to half cup of spinach. And when we talk about the price, the price for broccoli is actually higher if compared to spinach. That's why it's fine for us to get the lower cost, to get spinach, which is cheaper. And other than that, I also actually it's quite commonly seen that cancer patients are drinking this alkaline water because they thought alkaline water can actually help them to neutralize the toxin in the bodies. Then this can help them to protect the body from getting cancer or against cancer. And when we look at the studies, nutrition does not affect the overall pH of the body because if we have a healthy kidneys, right, it can help us to maintain the pH level of the body. According to Malaysian guideline, we are advisable to drink 6 to 8 glasses of plain water or any drinking water a day. And if you are doing a lot of exercise, you need to increase the water consumption at least 2 glasses a day. Another fruit that quite famous among cancer patients is sour soup. They also believe that sour soup can actually use to treat cancer, can be a type of cancer treatment. When we look at the scientific paper again, when we look at the studies, the evidence is still very limited. We need to conduct more human studies to see the effectiveness in treating the cancer. In that case, we are advisable to follow the guideline, the Malaysian guidelines, to eat 2 servings of fruits every day. What is considered 1 serving? If you eat apple, 1 medium size of apple is 1 serving. If you take banana, it's 1 medium banana. If you take grapes, like small size of fruits, you can take like 6 to 8 grapes. Or if you take like longan, it's like about 8 pieces. If you take raisin, it's 1 tablespoon. If you take fruits like papaya, honeydew, or watermelon, this kind of fruits, 1 serving is 1 slice. So another famous herbs or plant that the cancer patients normally use to eat during cancer treatment or once they get to know cancer is Caladiticus. Caladiticus is a type of plant that is for them they normally use to treat like traditionally used to treat like to strengthen the immune system. So actually, according to study, there's no human studies is conducted to determine the effectiveness yet in treating cancer. So if you are taking any herbs or any plants products, right, you need to consult the doctors. You need to you need to see doctor, or you need to inform your doctor. At least they're aware of what you are taking. And the next food we are going to discuss is animal food. When they get cancer, right, normally they were taught that I need to be a vegetarian. I cannot eat animal food. I cannot eat chicken. I cannot eat fish. I cannot eat eggs. I cannot eat meat. I cannot eat prawn at all. They feel if we are taking, once we have cancer, right, we need to eat as healthy as possible. In their thought, they feel vegetarian diet is a healthy option for them. So when we look at the study, according to World Cancer Research Fund, there's no study showing that eating fish or lean poultry can actually increase the risk of getting cancer. So, and especially during cancer treatment, right, protein is very important for us because protein helps us to heal the injured cells, or to speed up the recovery process. So what is considered one servings? We need to eat fish, lean poultry, and eggs in moderation. What is mean by moderation? When we take chicken, 1 palm size of chicken is considered 1 servings. And then when we take eggs, is 2 medium size. If we take fish, is 1 medium fish. So one day we need to, when we talk about protein, during each main meal, like breakfast, lunch, and dinner, right, we need to have 1 servings of protein during each main meal. And lastly, we are going to discuss on organic food. Normally, cancer patients feel that after I got cancer, I cannot eat commercially produced food. I can only eat organic food. So, and when we look at the study, when we look at the scientific paper, eating organic food is actually not proven to be better. And when we eat commercially produced food, is actually as safe as organic food. It is not necessary for us, or it is not a must for us to eat organic food. The most importantly, we need to eat sufficient nutrients by eating 5 servings of fruits and vegetables. So when we talk about fruits, I think we have discussed earlier, 1 servings of fruits is like 1 apple, or 1 slice of papaya, or 1 medium size of banana. When we talk about cooked vegetables, 1 servings is actually 4 tablespoons. So we are advisable to take 2 servings of fruits and 3 servings of vegetables every day. Okay, so I think we need to get the right information from the scientific or credible source. And today I will pass this to Joanne. Hi, Joanne.
Hi, Crystal. Can you hear me now? Can everyone hear me?
Yep.
Okay, thank you for very informative sessions. I think truly some of the questions that you have posted or shared just now are very common, like among our daily life, where people will always tell us that don't eat chicken, I tell you, because there's a lot of growth hormone. So I mean, truly it is very insightful to listen to you today to share with us some of the scientific based evidence to see what we should eat and what we should not. So there are some questions coming from the audiences. So we have Seaman who asks, is there any concern to eat antioxidant food during treatment? So I think berries are one kind of antioxidant food, but how about the rest of the antioxidant food? Does that really help for treatment or not?
When we talk about fruits that are high in antioxidant, we still need more studies to confirm the effectiveness, because we do know how much, despite the presence of antioxidants in fruits, we still need to know the dosage. the amount of fruits that we need to eat in order to get the effect. Unfortunately, we still need more studies to confirm the amount. That's why we don't use it as a standard recommendations for cancer patients, especially during treatments. What we can confirm is actually the vitamin C content. Yeah, the vitamin C content. So vitamin C can actually help us to, because vitamin C is proven to 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 strengthen our immune system. So vitamin C is actually can normally found from any type of fruits. So what we emphasize is vitamin C instead of the antioxidants.
Mm. Yeah, because you know, antioxidant food usually found in berries and all that, right? Very high in berries. So to spend a lot of money on like blueberries, blackberries, strawberries are also quite a lot. So not sure how much to eat in order to see the effects, right? Probably you have to eat a dozen to truly see the effects. Okay, got it. So question from Simon as well. Chicken always is penalized for cancer relapse. Is that true? So I think, I mean, just to add on to that, right, at least based on my understanding, a lot of time why people say don't eat chicken because of the growth hormone inside chicken. They say if you want to eat, you eat the kampung chicken or those like free range one where there is no hormone injected. So what is your thought on that?
Okay, so for regarding this concern, I would like to say that I wouldn't emphasize much on the way of productions. For me, nutrition content is the most important things to discuss because during treatments we need to eat sufficient protein. Protein help us to recover faster, to help us to speed up the recovery process, and it help us to maintain a good nutritional status. If we get sufficient protein, we are fit enough, it can help us to complete the treatments with a good nutritional status. Yeah, that's why we don't need to we don't need to like emphasize more. We don't need to emphasize on the way of production, the productions method. The most importantly, we get the sufficient nutrients. This is the key. Yeah.
I see. Will the growth hormone fuel the growth of the cancer? Because like relapse, right? You need to say the cancer coming back or something like that. Is there any correlation? Like today, if we eat poultries or any meat products, right, that have this hormone injected in it, is that going to fuel the cancer to grow faster or the cancer to come back? Is there any study to show that?
We cannot confirm this. Yeah, we cannot confirm this yet because there's no study can confirm this statement. Yeah, maybe in the future, but not. But now we don't have sufficient evidence saying that.
Okay. Also, question from Simon: gluten-free products, are they better for cancer patients?
For cancer, yeah. There's no scientific paper saying that gluten-free is better for cancer patients. Yeah, the most important thing, we need to eat a balanced meal. We need to get sufficient nutrients and energy from from our diet. Yeah, in order to keep up the strength to deal with the side effect of cancer treatments or to maintain a good nutritional status.
Okay. Okay. So Ivy has a question. She say, how about Chinese herb soup like bak kut teh? Because you know, I mean, we being Chinese, some of us over here truly like to eat herb related food. I mean, may not just be bak kut teh lah, but maybe some of the other Chinese herb as well. So, is that helping the cancer recovery or making it worse, or there's no effect?
Okay, yeah. So regarding to this, right, if actually it depends. If the patient is undergoing cancer treatments, normally we won't advise patients to take Chinese herbs. I think for bak kut teh, like all this, right, it's not that concentrated. So you are still allowed to eat, but for those in concentrated form, we normally don't advise to take it during cancer treatments. After cancer treatments, if you want to take for you to recover better, it's up to you. Yeah.
Okay. Okay. Is there a reason why during treatment time we try not to take Chinese herbs and all that?
Because during treatment time, right, the patient is taking chemotherapy drug. It's actually quite burden for our organs. So, and when we take the Chinese food, right, it's actually is in the normally it's in the concentrated form. We don't want to have the what interactions like
Interaction. Yes.
negative interactions between chemo drug,
Yes.
between chemo drugs and the Chinese herbs.
Yeah, it makes sense. I think we also hear something very similar is that sometimes when you're having treatment, so because we are taking drugs, right? So try not to at the same time take Chinese medicines for now because it may have like drug interaction that we are not very sure about the effects. So try not to take the risks during treatment time. But probably if you want to do it after treatment, it's truly up to your own discretion. Okay. Okay, Kit Tan has a question. What about cooking oil? So do we have to use like the organic one or olive oil? Or doesn't matter if I want to use just normal peanut oil, it's also okay. Any correlation?
Yeah. So actually, there's no study saying that if you are taking olive oil or like those like high-end oil, right, is better for cancer patients. Yeah, you are feel free to to use any cooking oil in your cooking. Yeah, it's fine.
So the oil it's mainly for the heart protection, right? There's not so much on cancer treatment.
Yeah, true. But sometimes when the patient is on the patient is underweight, is they are losing weight. So sometimes we will actually advise the patients to get like like omega-3, but not to put in the cooking lah.
So seafood like fish, salmon, it should be quite good for patients.
Actually, for cancer patients, it's not a must for them to take like salmon, fish that high in omega-3 because during treatments they cannot eat much also because of the side effect of treatments like nausea and vomiting or low of appetite. Yeah. So like for the patients who are really underweight or they lose a lot of weight during treatments, we will advise them to take like oral nutritional supplements that is enriched with omega-3 for them to make their body weight stabilize. Yeah, to stabilize their body weight. Yes.
Okay. So Alex has questions as well. He's saying that is pork considered a no-no for cancer patients? I mean, this is for for our audiences today that are non-Muslim over here because some of them are also consuming pork. So is pork considered a no for cancer patient? Or generally speaking, probably it's a poultry products.
Pork is actually considered red meat. For cancer patients who are undergoing treatments, I don't think there's a restriction for them. They can take like three palm size a week. There's no restriction for them, basically. But for those who already completed treatments, already lived with cancer for a long time, like more than 5 years, 10 years, I would advise them to eat more on white meat, like fish or chicken. Yeah.
I see.
Because according to because according to study, if we take red meat more than 3 palm size, actually there's an association with colorectal cancer.
Oh. Yeah. So example of red meats are like
3 palm size a week.
Three palm size, right? This is 1 palm. This considered 1 palm size?
Yeah, this is
okay.
1 palm size.
Okay.
Yes.
So example of red meat are, for example, beef, lamb, duck, pork as well. How about chicken thigh? Because sometimes when I notice, right, like the chicken thigh part is red, more red than like the rest of, let's say, for example, chicken breast is whiter. So we know chicken generally is white meat, but is chicken thigh partially red meat or they are also white meat?
We don't, because when we classify the types of food, right, we don't classify based on the area. We classify the whole food. So actually, regardless of the area, chicken is considered white meat. Yeah.
Oh, okay. So seafood like prawn, squid, they are also fine for cancer patients who undergo treatment, or we try to avoid seafoods as well, or shell food during cancer treatment.
I think what's their concern is because they worry that if they eat like shellfish, right, it's very hard for them to wash properly, the food safety concern. So like for those patients who are undergoing treatments and they have low neutrophil counts, if they are at risk of infections, right, then they are not advisable to take this shellfish. If they can wash it properly, then it's fine.
I see. Okay, there's these questions from Weichi, which I think many of us also have the same concern, because it's like we as Malaysian, right, majority of us like to eat durian. So for cancer patients, or whether they're on treatment or they're survivor, can they eat durian or not? Because as we know, durian is one, quite heaty. Second thing is also high in sugar. So is that advisable to eat durian?
You can eat anything you want, including durians, but we need to limit the portions. One servings of durians is actually three small seeds. Yeah.
Okay. 3 small seeds. So it's like a kampong durian size seed or a D24 size seed is different.
Yeah. It's about like 24 size seed.
Oh, it's more like a D24 size seed. Okay. So taking one portion or around that, it's still okay in that sense, right? Means that take food in moderation now. Okay. So I think
everything just takes moderation. Yeah.
I think question from Lisa as well. For cancer survivors, are there any food to avoid, or we just eat like normal? I think Crystal has already answered. The question is we can eat most food in normal, just that we need to eat in moderation. Crystal, you have anything to add on to this? Because Lisa has a question. Is there any food that we should avoid, or we can just eat like normal?
For cancer patient, basically there's no single food that you need to avoid. The most important thing is you need to eat a balanced diet. I think everyone's know about suku spiral concept, right? Yeah. So half of your plate should fill up with fruits and vegetables, and then quarter of your plate should fill up with grains like rice, bread, and like jagung. And then another quarter of plate should fill out with the protein sources. Best go for white meat and use low fat cooking method like grilling or stir frying or steaming, boiling.
So can we eat fast food?
This is a very tricky question, I think. I think everyone eats fast food, but we need to limit as much as we can. Like for me, I will limit myself to once a month. Yeah, I think because we are human, right? Sometimes we want to enjoy, we want to try different type of food. So yeah, set a limit for ourselves.
Okay.
I think we can set the limit for ourselves. If you want to eat fast foods, but just limit to like once or twice in a month. Yeah.
And reason for that is because generally we know fast food is not good for general health already, right? So it's not bad.
Yeah. Because fast food is not, they are not made from fresh ingredient, and it's added with high sugar, high salt, and also high fat.
Okay. Lisa has a question. How about tin food, like sardine, red beans? Is that okay for a survivor to consume?
Because actually actually I would advise everyone to go for fresh ingredients first, because sometimes, right, we are very busy with our work. We have no time to prepare food. Canned food or tin is actually one of the options that can ease our job every day. So if you are not able to cook, you can actually go for like canned food, but you need to know how to make the right choice. Try to choose when we look at the nutrition facts behind the canned food, right? We need to know how to choose the one with low sodium, low sugar. Like for example, when you go to supermarket, when you look for tuna, like canned tuna, right? You can choose the tuna in mineral water instead of the tuna in like spicy tuna or tuna mayonnaise. Yeah.
Oh, okay, okay. Yeah, yeah, makes sense. Okay, supplement. Like we know there's a lot of direct sales product, right? That say that, I mean, there are so many MRMs out there that talk about nutritional supplements and all. Is that advisable for cancer patients or survivors to take these supplements? Or you think that we should be able to get enough nutrients from food?
As long as you are able to get sufficient nutrients from diet, if you follow the suku spiral concept, it's fine for us not to take supplements, because supplements is to, but some of the patients, right, especially cancer patients who are undergoing chemotherapies or undergoing cancer therapies, if they are unable to eat sufficient food from their diet, sometimes we will recommend them to take supplements, but not to replace our daily meal. Like other than that, for cancer survivors, because I also noticed that cancer survivors normally take supplements as a method to prevent cancer, right?
Or prevent the cancer from coming back.
Yeah, they take a lot of supplements to prevent the cancer recurrence. So again, according to the World Cancer Research Fund, we are not recommended to rely on supplements to prevent cancer recurrence. You need to practice, you need to eat a balanced meal. A balanced meal is actually a key here. Yeah, we need to eat a balanced meal. As long as you can practice this, you can keep yourself healthy and reduce the risk of getting cancer.
Okay, so a continuation of Simon's question, she's like asking example of supplements that maybe some of the cancer survivors are taking. Like you just mentioned just now, some of the cancer survivors, they will take a supplement. So do you know like what type of supplements are they taking? Simon, I hope this is the questions that you're trying to ask. So if it's not, you can put it in comment and be more specific about the question. I think maybe for the rest of the audiences as well, we also wanted to know what are the example of supplements that some of the cancer patients or cancer survivors like to take. Is it like calcium pill or multivitamin? I don't know.
Okay, so what I can see from the cancer survivors is when I listen to them, right? Normally they say they like to take this like antioxidant supplements like lutein, berries, broccoli extract. These are the common supplements they are taking to prevent cancer recurrence. And also they are taking this resveratrol, one of the active ingredients in red wine. Yeah.
Oh, okay.
But actually, all this is not scientific proven.
Okay, and it's also quite costly, right? If I remember it correctly.
Yeah.
Okay, so I have a question for myself. It may not be very much related to cancer patients. Coffee, because I think many of us like to drink coffee in that sense, right? Like for myself, I'm heavily depending on coffee to a certain extent. But there are controversial studies. Some say it's actually bad for you because it causes osteoporosis. Some say no, it's actually good for your heart. Protects the heart. So I mean, if say a cancer survivor in that sense wanted to continue his or her normal life by taking 1 or 2 doses of coffee or 2 cups of coffee, is that okay, or it is a no? What is your thought on that?
For coffee is depends regarding to this, right? It actually depends on how do you make it. If you make your coffee with by adding a lot of creamer or sugar, definitely it is not good for you, because if you add a lot of sugar or creamer, it can increase it will lead to weight gain. It will increase your risk of getting like other it will increase your risk of getting diabetes or heart disease, Yeah. So if you are taking coffee, I will advise you to not add too much sugar, maybe half teaspoon or and try to limit the consumption of creamer as possible.
So if it's like black, it's
If
okay.
it's still fine, black coffee is definitely okay for everyone to drink. Yeah, because it's without sugar, right?
Yeah. And no creamer. Okay, I think Simon explained the question. She's asking that supplement that usually recommended during treatment when there is insufficiency of nutrition. So what is the view from the dietitian?
Sorry, again, I can't hear clearly.
Supplement that usually recommended during treatment when there is insufficiency of nutrition from the view of a dietitian. So I think what Simon is trying to ask is, for example, we know some patients have difficulty eating or there's no appetite at all, maybe during treatment especially. It could be due to side effects or the treatment, ongoing treatment, right? So sometimes they have like products that ensure those meal supplement products or some other supplements that will be recommended for during treatment. So is that okay? What is your view on this?
Okay, so as we know, during cancer treatments, we will experience a lot of side effects like nausea and vomiting, or our appetite will be reduced. So at this time being, we cannot eat sufficient food to keep up our strength to complete the treatments or to deal with the side effect of treatments. So we will recommend something. We will recommend like oral nutritional supplements that contains high calorie and also high protein, so that when patients consume, they will have enough energy and protein to complete the treatments. We are not normally we don't really recommend the supplement in the pill form but it's actually based on the condition as well. If the patient's HB is very low, sometimes we will recommend iron tablet also. It actually depends. Yeah.
So it depends
But
on
but our first option is always but the first option is always oral nutritional supplements, like what you mentioned just now, the products that in powder form that contains high calorie, high protein that we can find in pharmacy.
So I think the ultimate answer is it has to depend on the patient's condition as well, or the individual's condition, before we can recommend what type of supplement is best for the patient. Also, like what is the level of nutrition deficiency in this case? Is it because of low iron, or low HB, for example? Then probably they need to take iron pill. So it's very much depending on the individual's condition.
Yeah, true. Because different type of cancer, the side effect is different, right?
Yeah, it's true, because of different treatment. Grace has a question. Chinese tonics, like for example, ginseng, lingzi, which are very renowned Chinese nutritional food rather than supplement. Is that recommended for maybe cancer patients or even survivors to take like ginseng or lingzi?
Ginseng and lingzi is a type of like Chinese herbs.
Yes.
Right. It's not considered, maybe it's not considered supplements, but it's categorized as herbs. So we are also like, as what we mentioned just now, like during cancer treatments, because of the burden of chemotherapy, we don't actually ask the patients, we don't advise the patients to take lingzi or ginseng, because these two herbs are very concentrated. Yeah.
Okay. Yep. So okay, Simon also has a question. Simon is very attentive to this session. Thank you very much. Red wine can help to increase red blood cell during treatment. Is that true? True or false?
According to study, there's no such finding, right? At this moment, we don't advise patients to take red wine to increase the blood cells. We will advise patients to take red meat to increase the blood cells during chemotherapy. But still we will have, we need to, we have the portions, we have the recommended serving size for them lah. Not more than 3 portions a day. Sorry, a week.
A week. I think
A
we have
week.
spoken.
We will advise like 2 portions a week.
I think we have spoken quite a bit on the suku separuh, right? Maybe after this session, what we can do is we can share a poster on to illustrate what do we mean by suku separuh. So at least people will be able to understand better in terms of like, you know, what is the appropriate portion of food that is recommended for us to take lah. What do you think? Think okay, Crystal?
Yeah.
Yep. Yeah. Grace has a continuous question. So yes, we know that ginseng or linzhi may not be good for patients during chemo, right? Because fear of the drug-drug interaction or because it's very concentrated. How about for survivors? Means after treatment, after chemotherapy. For general well-being, is that recommended to take ginseng or linzhi?
I do specifically recommend cancer survivors to take linzhi or ginseng to like strengthen their immune system or to prevent cancer. But it's actually up to you. It depends on you. If you want to take, it's fine for you to take. Yeah.
So we need to say this is a Chinese view and Western view. Okay. Lisa said, how about white? Is there any way that we can increase our white blood cell? How to increase white blood cell?
There's no. Okay. There's no specific. Okay. Can you hear me? Yes.
Yes,
There's
yes.
no specific food that can. Yeah. There's no specific food that we can eat to increase white blood cells. We need to eat, we need to include all the food groups that we need to include all the food groups like grains and the protein and also vegetables and fruits in order to in order to have a healthy or normal blood results. It's actually basically it's a balanced meal lah, the suku separuh things also.
Yeah, so I think the suku separuh is very important for us to at least have a bit illustration to know better what does that mean. Like for me myself, I don't think I am able to comply to suku separuh as well, but it's something for me to reflect on and perhaps take a more balanced diet. Yeah, so I think we have come to almost the end of our live session, and we have many questions coming from our audiences, which is very good. It shows that we are all paying attention to the food that we are eating and try to make sure that we maintain a balanced diet as well. So if you have any more questions, you can always still drop comments into our page or to NCSM page as well, and we can come on some of your questions. So before I end today's sessions, I would like to take this opportunity to thank Crystal again one more time for your time today, and for everyone over here. Next week we are going to have another session, but it's more on the psychological, psychosocial part, the aspect of psychosocial and cancer management. It will be same time, 4:30 to 5:15. So please invite some of your friends or anyone that you know or within your connections to also join our live education as well. Okay, so thank you very much, Crystal. And for the rest of the people, thank you for joining us today and have a very good weekend. See you all, take good care and stay safe. Bye-bye. Thank you.
Bye. Thank you.